Hi, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kym Douglas. On today's episode, we're going to talk about your heart. Cardiovascular disease is the leading cause of death in both men and women. And our guest today wants to make sure that you have as much knowledge as possible to empower you when it comes to your heart health. Dr. Nicole Weinberg is a non-invasive cardiologist at Providence St. John's Health Center and is also part of the Women's Heart Health Center right here at St. John's. Welcome, Dr. Nicole Weinberg. Thank you for being here.
Thank you.
We're so happy to have you. So let's jump right in. What is a non-invasive cardiologist?
So I'm a cardiologist who does no procedures. I don't do angioplasty. I don't put stents in. But I see patients, a lot of patients in the office that are concerned about their risk factors for disease. We do a lot of preventative health. If somebody has a significant family history, I read ultrasounds, we do stress tests, things like that.
So it sounds like it's preventative.
Lots of prevention, absolutely.
That's so important. So how do you describe the complexity of the heart to your patients?
So it's a good question because a lot of people come in and they say, I don't understand, how can this be the leading cause of death? I don't know that many people that have had a heart attack. Heart attacks are one piece of a large puzzle. I generally think of the heart as a house. You know, it has plumbing. So that could be like, do you have a blockage in a heart artery? Or if there's an electrical problem, do you have a rhythm disturbance? Do you have atrial fibrillation or something that requires a pacemaker? Or do you have a structural problem? Do you have a problem with like your valves? I think of them like the doors or the windows of your house, or a structural problem like a cardiomyopathy where the squeeze could be a problem. That could be like one of the rooms is too big or something like that. So I really try to tease through the details when a patient comes into the office based on their symptoms to try to figure out what part of the house is the problem.
Right. I love how you put that in layman's terms, and I feel like you're talking about my house. I've got some plumbing problems. I've got some structural problems. Wondering if you could
Hopefully
come
not
help.
that bad.
Yeah, exactly. So what are some of the signs that the heart isn't functioning properly, and when is it time to call 911?
Right. So I think there's a lot of popular information out there about chest pain and shortness of breath, and I think those things are really important. There are other things that we look for, like if somebody has swelling in their ankles or they can't breathe when they're lying flat in bed. Those are things that we would also pay attention to. Unusual heartbeats, lightheadedness, feelings of fainting. And then one of the big things that I always tell patients, because they may say, I have those symptoms sometimes, but then I don't have them other times. I love it when my patients exercise, because if you have your symptoms and they're worse with exercise, that's something that I really try to dial into. If you have them once in a blue moon and maybe they're linked with food or a stressful situation, it doesn't necessarily mean that it's not related to your heart, but it may not necessarily be that same degree where you would be wanting to call me or go to the emergency room or something like that. But the exercise component, I think, is a really interesting piece of the puzzle.
Oh, absolutely. And I think we're going to get into that in just a little bit. And speaking of that, it leads me into this question. Now, I know you personally do not treat him, but Bronny James, the 19-year-old son of basketball star LeBron James, just suffered cardiac arrest while at practice exercising.
Yeah.
And, I'm sure he exercises so much. So what can cause cardiac arrest, and how do we test for it and treat it? And why does this happen to young, healthy people?
Yeah. It's been devastating, I'm sure. And I think it's also really scary to so many people. We've had other athletes that are notable that have had medical issues really lately. And I feel it drives home the point that you do have to do a lot of body awareness, some testing. I think about these situations like the house. You just go back to the house and say, okay, could there be a plumbing problem? Okay, let's look at the heart arteries. Okay, could there be an electricity problem? What's going on with the electrical current? Was this young athlete born with some sort of electrical current dysfunction? Or is there a structural problem? Could he have had an illness? We learned a lot during COVID that people can have viral illnesses and have dysfunction of their heart muscle that can lead to a variety of different problems. So you just kind of go back to the basics and say, okay, get a good history, do some basic testing, and learn about this person's insides.
Because you would think that this young man is probably one of the most healthy specimens around.
Right, absolutely.
So what can cause a heart attack?
So there are typical things that cause the heart attack, like a blockage in a heart artery. And those are things that, we kind of just dial back to the plumbing issues. Do you have buildup of plaque, cholesterol plaquing in your heart arteries? And if you do, and those become narrowed, you can have decreased blood flow to your heart muscle. And when that blocks off, that's a traditional heart attack.
Sure.
There are other ways that you can have some of these markers and elevation come up in your system. You can have some chest pain. And again, goes back to the house. Do you have a structural issue? Could you have something like myocarditis, like those inflammations within the heart muscle? Could you have an electrical current problem that's causing your heart muscle to stop or squeeze in a dysfunctional fashion? So I think that's a lot of what we do in the world of cardiology, kind of peel back the layers and figure out where the problem lies.
Such good analogy, truly, about the house. I will always think of that. Yeah. So besides heart attacks and cardiac arrest, what other problems can happen with the cardiovascular system?
Yeah, it's interesting because I think because so many people are living so long with cardiovascular disease, thank goodness, we are seeing a lot of different issues associated with rhythm disorders. And so again, going back to the house, we think about the electrical current. So a lot of patients that, would have maybe not made it through a heart attack or not made it through some of these other valvular heart disease issues are living through them. And then we're seeing some scar tissue in their heart muscle or some structural dysfunction that can lead to electrical current problems. So we're learning a lot more about that. And I think we may be talking about this in a little bit. There's a lot more ability for us to get information on rhythm disturbances now. Before, it used to be like these one-day heart monitors where if you didn't have symptoms on that one lucky day, you could say, for a week, I have all these symptoms. You would wear the monitor for one day and it would never pick anything up. But now we have all these other like artificial intelligence technologies where we can start to pick up rhythm disturbances in a way that we never could before. And it's such a blessing. If we could have a silver lining of COVID, that's maybe one of the silver linings of COVID, that a lot of people got different technologies at home to be able to follow what's going on in their heart at home so that we can provide better care.
So good. Now, before we started the show, you and I were chatting and we were talking about you being the mother of 3 and traveling and working out and doing surgery, literally, curing people. How does stress cause a strain on the heart? Because we all, Dr. Nicole, we're all just stressed all the time.
Right. Well, it's funny because I think back to when I was in medical school, which let's pretend that was 5 minutes ago, but it was a while ago. And they said, if you have a type A personality, if you're a stressed person, that's not going to lead to like a medical problem. And I love that has been disproven time and time again. We obviously have pretty significant disorders within the cardiovascular system where stress leads to problems. So we have something called Takotsubo syndrome, which is a stress-induced cardiomyopathy. It's something we see more in women than in their male counterparts. And it has to do with a very stressful event that causes your heart muscle to balloon out in the shape of this Takotsubo, which is some sort of octopus pod. I guess it just kind of, triggers this shape. And that is something that is purely stress-induced. There's some sort of, catecholamine surge in people's system that causes this. We see these things also on, smaller levels. It doesn't have to be something so stressful like a death of a spouse or being held at gunpoint. Patients that have chronic stresses in their system like depression, or, certain stresses at home, we see that they may be having inflammation within their blood vessels that kind of triggers these buildups of plaques in ways that maybe they wouldn't for our counterparts that are not dealing with those stressors. So it's something that I think is a really growing area of research within the world of preventative health. And every year there's more and more information to help us identify the at-risk patients.
Which is so valuable. Why is it important to know your family's history of cardiovascular disease, and is it hereditary?
Yeah, so similar to the stress analogy, once upon a time we thought, well, family history is family history. What if they, lived somewhere where they ate poorly and smoked all the time? Well, we're learning that family history is probably a huge piece of the puzzle. And a lot of that is because we're learning about some of these genetic predispositions, some blood work that you can test for people that will tell you if there's an abnormality like lipoprotein a. That wasn't something that we paid attention to before, but we understand that that's a genetic marker of cardiovascular disease. It puts you at risk for not only coronary artery disease, but also aortic stenosis, so valve structure of the heart, as well as plumbing issues. And so I think really understanding your family history is very important. It's not to just say, well, they had a lot of stress in their life, or maybe they were a smoker. Okay, maybe they had those things, and maybe you don't have a genetic predisposition, but maybe you do. And wouldn't it be great to identify that and then try to combat that risk?
So we had talked about this earlier. Now we're really going to delve into it. What is the recommended amount of exercise? And truly, you are a great example because you're in great shape. You've had 3 children. You look about 20, which you probably are. But I mean, you obviously exercise and keep your weight in check. So how important is that for good heart health?
So first of all, thank you very much.
Welcome.
Second of all, the American Heart Association does not make it difficult. They want you to exercise for 30 minutes a day.
Okay.
So that's not something that you can achieve.
Yeah.
And even this is a great time of year to have your dinner and go for a walk outside afterwards. It's perfect. It's easy. It doesn't have to be an intense exercise. You don't have to do anything like that. But if you do dial it up and you have more intense exercise, then the American Heart Association says you don't necessarily have to do that every day. But some people just feel better when they're exercising. I find that my patients that do some degree of exercise, whether it's folded into their activities of daily living, I'm going to, walk to the grocery store and walk to, the drugstore and walk to pick up my dry cleaning, and then I'm going to walk home and carry all my packages. They do as well as people that are going to the gym and exercising, but I think it's important to do something.
Oh, I love that. And just like you say, the normal walk or just incorporating it into your own life. I know for me, with interviewing all of you wonderful doctors from St. John's, I tend to, if I'm going to a mall, I park a little bit further away. There's all those little normal things.
Right. And then you just string it together and all of a sudden you've had some good, you've gotten your steps in, you're feeling good, you're maybe carrying something heavy.
Right.
I don't think it has to be terribly complicated, but it does have to be something.
Speaking of that, then how important is a good diet and sleep in maintaining a healthy heart?
So I love that you brought up sleep.
Yeah.
I really feel sleep is like this black box of medical research. We're just starting to learn a lot more. And again, silver linings of COVID, we now can do some home sleep studies on people and really start to delve into what their issues are more and more. I find that some of these technologies that people can do at home give us much more information about what's going on when a body is supposed to be resting. Are they really resting? Are they not resting? Are you getting good REM sleep? Are you not? Are you having rhythm disturbances? Do you have bad sleep apnea? How does this affect your overall cardiovascular health? But not only that, your weight, your blood pressure, your metabolism, how awake you are during the day. So I feel like sleep is super important. Diet, I feel we've, kind of beat that over everybody's head. Diet is very, very important. And I think the pendulum kind of swings back and forth in terms of, super low fat. Okay, having some good fats in your diet,
right?
Swinging back and forth. But again, I kind of feel like it goes back to what your parents told you at home. You want to have 3 meals a day. Right. You want to have a colorful plate. Balance. I think dialing back to the Mediterranean diet is good. It doesn't have to be, no
bread ever.
No bread ever, or no fats ever. You want to have healthy fats. But, if you fold that into a diet where you're also going for a walk after you eat and things like that, you're actually using that food as energy for you. And so it kind of makes sense. That's what we're supposed to be doing.
So great. Just on a personal note, I do get 7 or 8 hours of sleep, but I'm a really late nighter. Does that affect? I go to bed really late.
Yeah, but you're getting your sleep in.
Okay?
And so I think as long as you get the sleep in, I think that that's really what's important. And if the sleep is kind of good quality sleep, you wake up and you feel rested, I think that's important. It kind of harkens back to some of this, we always used to say, well, I pulled an all-nighter and I did, there was so much congratulations.
Right.
And not sleeping well or being able to subsist on
4 hours
coffee all day. And we're learning so much more that's not.
Just woke up. Sorry.
We're learning so much more that's just not the shining example of good health.
So good. Such a good point. So one topic that we haven't touched on is cholesterol. Tell us about the good, the bad, the ugly, what these numbers mean. Yeah. Bring it home to us like the house, you do.
Yeah, well, I think, these parameters have been checked for decades, the traditional ones, LDL, HDL, triglycerides. And they're I think, good standard markers that you should get with a physical, an annual physical exam. Your low density lipoprotein is the LDL, that's the bad.
Okay.
The HDL is generally the good, that's the high density lipoprotein. And the triglycerides are the ones that are generally more variable, linked with sugars and things like that. That's why we generally have you come in fasting for the blood work. I would say they're good parameters to look at. The variability in terms of the way we've looked at them over the years has kind of shifted. So once upon a time, they said your LDL less than 130 was good. Then it's less than 100. Now, depending on certain risk factors, we do like less than 70 or even lower than that. As a cardiologist, I sometimes like to do advanced lipid testing. And so we do the basics, the LDL, the HDL, and the triglyceride, but then we also do some advanced lipid testing, like looking at their lipoproteins, looking at the breakdown products of the LDL and the HDL. We do things like that lipoprotein Lille, which is more of a genetic risk factor that I had mentioned before. And there's so many different things coming down the pipeline so that we can be able to look at these patients and say, okay, so you have this family history of cardiovascular disease, but your cholesterol looks beautiful.
And what number would that be? Just in a broad, and I know everyone's different. But
yeah.
Like
so let's say you came in.
Yeah.
And you're feeling good, but you say, my family history is a little bit concerning and my LDL is less than 100.
Okay.
So I might say, okay, that's good. Let's look at some of your advanced lipid markers to see, does that one less than 100 LDL actually mean different things? Do you have some more inflammation within the particles of your cholesterol? Do you have maybe this lipoprotein Lille that, what if it's, extremely high? Then it doesn't matter that your LDL is less than 100. We still would probably want to scratch this itch a little bit further. I think about preventative health as like, it's like a stew. You're putting a lot of different variables into the stew, and we've got to tease through these different variables to see, well, what are the ones that mean the most as it relates to your body? So again, you could have a completely normal cholesterol and, in awful circumstances, sometimes need angioplasty or stents. And so that can be really earth-shattering for people. But I think that's why we look further so we can identify our at-risk patients and hopefully prevent them from having any sort of procedure therapy if necessary.
So I didn't wear it today, but I always have my Apple Watch or Fitbit. Also, people can get, the odometers or whatever for inexpensive to put on their shoe. So how effective are those wearable devices when it comes to monitoring your heart?
Yeah. Well, as a practitioner, I love that data. It gives me information about what's going on with patients at home. What is their heart rate? How much do they walk? How much do they exercise? And even on the Apple Watch, you can get some good EKG data. It's a bit more rudimentary than in the office, but it may clue you into some rhythm disturbances. And so for us, we're picking up a lot more atrial fibrillation and things like that at home, which I think is a real blessing. Yeah. There's also different parameters on these devices that can tell you how variable your heart rate is. Like how often is it slow? How often is it fast? How often does it sway between the two? And there are different parameters as it relates to exercise that can tell us if that's helpful information or not. So bringing that device into your doctor's office when you go in and having the practitioner be able to tease through the data and see, how important is this is a real blessing, I think.
Oh, absolutely. Let's talk about women. So tell us the difference between women and men in the world of cardiovascular health.
Yeah. So this is a broad topic.
Yes.
But I think a lot of it is really about teasing through the details of your patient's life. So for a woman, she may say, I had some of these issues when I was pregnant, or I had a preeclampsia when I was pregnant, or I had gestational diabetes. Those are going to be risk factors that we want to dial into that, our male counterparts who have not been pregnant won't have. But also we may find that, the women may say, all the men in my family had heart attacks before the age of 50. And now I'm menopausal. I'm 50 years old. So what does this mean for me? And so I think teasing through some of that data as it relates to our male and our female patients gives us an understanding of where their disease is going to actually fall for them. There are different disease processes that women get more than men, some autoimmune diseases like lupus. And so some of those things will clue us into as their practitioner, what we need to look at further. Somebody that has like chronic inflammation in their system because they may have rheumatoid arthritis or something like that, they may be at risk for different cardiovascular conditions, and we have to pay attention to that as their practitioner, treating them differently than somebody that may not bring that to the table.
That's so important. So why are stress tests important in monitoring the heart, especially during peripartum period?
Yes.
Tell us what that all means.
Yeah. So stress tests are great. We're looking for blockages in the heart arteries that are 70% or greater. So when we see that, it gives us an indication that, okay, this person may, need some sort of interventions, whether it's medication or procedure based. There's other data that we get from a stress test that's really important. We monitor blood pressures, we monitor heart rate, and in some studies we also monitor their heart with ultrasound, so we may be able to detect some valvular heart disease or pressure changes in the heart that are a little bit different. And so depending on what's going on with the patient's life, we may say, we're worried about a blocked heart artery, but also we really want to see what your body is doing under stress. So, certain other conditions that patients can have may necessitate a stress test when we're not just looking to see, do you have a blocked heart artery?
Interesting. Empowering patients. Why is that so important?
I think this is like the number 1, 2, and 3 message for patients. If you don't bring to your practitioner some good information and advocate for yourself, we have all this, history in my family that's very concerning. I have these symptoms that nobody's been able to explain. Then, you're not going to be able to get exactly. You can't get anywhere. And I think getting a good history from your patient is like the most important thing that you can do as a medical practitioner. And so if somebody comes in and they, I don't know, I just don't feel good. You want to really tease through, why do you not feel good? When does it bother you? How do these things, relate to, the quality of your life? What testing have you had? So I think it's really, really important to advocate for yourself, but also to bring that story to your medical practitioners and say it loudly in the office.
To be communicative.
Exactly.
So tell us about the Women's Heart Center here at St. John's.
Yeah. So we realized that when we were seeing patients in the office, there's a bunch of us female cardiologists, we were kind of saying the same thing over and over again. And we realized, what? The information that we're giving is not a secret. Like, we want to, shout this from the rooftops so everybody can know what we're talking about. And so over time, we've kind of gathered more and more female cardiologists at our practice, and we set up some meetings and some community programming so that we can really inform our patient population of their risks of cardiovascular disease and let them know, like, you don't have to wait until your doctor tells you, your EKG is a little bit abnormal. You can say, during pregnancy, I didn't feel well, or, when I got my period, I was having all these crazy heart racing issues, or, my cousin on my dad's side, has this very unusual condition. I want to see if I have some sort of genetic predisposition to it. So I feel that we have, kind of formed a nice group to be able to not only inform the community, but also welcome them into our practice to be able to tease through the details of their cardiovascular health and really give them some good preventative care, hopefully.
Yes, and it goes back to the empowering.
Exactly.
It really does. So this is my favorite part. Now it's time to talk about you. How did you become such a smarty pants and look so great and have 3 children and do what you do? But why did you become a cardiologist? Seriously.
Well, I say it's kind of genetic, actually. My father's a cardiologist. And so I feel like along the way, a little maybe fought it, because I thought, well, I'm going to be my own person. And it kind of brought me back in. My interests just were maybe genetically predisposed. But cardiovascular disease, being the leading cause of death, is also one of the leading causes with research. There's so much coming out, and I feel that we can do so much for patients. So it's just really, really interesting. It's stimulating on a daily basis. So it's not like you're saying the same thing all the time, not necessarily that anybody does, but every year there's new medications that are coming out. There's new techniques. I mean, think about how we treat open heart surgery now. People get valves put in, through, veins in their leg. And now with cholesterol management, we have injection therapy that people can get just a few times a year. And I just feel cardiovascular disease is just becoming revolutionized because it's the leading cause of death. And I feel so grateful to be able to be a part of it.
Well, we're lucky that you are. So to close the show, if there was just one thing that our viewers should take from today's discussion, what would that be?
I think it dials back to advocating for yourself, understanding there's a lot out there. Yeah. And sometimes your practitioners only know certain things, and you've got to bring a good story, and you've got to advocate for yourself. And there's probably always another practitioner out there that may be able to scratch the itch further if you feel like, wow, I just don't feel like my questions are being answered. And so I think really just being a good advocate for your health, doing all the wonderful things that I think a lot of people try to do, eat healthy and exercise, and getting the answers to your questions.
Yes, absolutely. Well, thank you so much. It's been so fun having you, Dr. Weinberg. It's really been a pleasure, truly. And thank you to St. John's Health Center Foundation and the many friends of the foundation for making this podcast possible. We appreciate all of you for listening and watching and joining us today. You can tune in again for more medical experts like Dr. Weinberg, and they give their insights and important topics. And if you've missed any of the past episodes, all you have to do is go visit yourhealthydose.org. Until next time, I'm Kym Douglas with Your Healthy Dose.